Hi everyone. This is my second live, so please excuse us. I am just waiting for Dr. Khoza to join us. This is a first for us. We'll be getting an expert to discuss. Hi there. We'll be getting an expert to discuss things that our clients find really, really difficult. Oh, I see there's Dr. Khoza. Dr. Khoza, would you like to join us on your business page or in your personal capacity? So you can choose. Otherwise, I will. Ah, there we go. Okay, so just going to ask her to join us. Okay, so while we wait for her to join us, there we go. Look at you. Oh, this is so exciting. I can't believe we got this right. Thank you so much. I feel like this is like so surreal. Thank you so much for joining me today, because I know you are really busy, and I know that I've discussed this issue with you so much that I thought let's share the wise advice that you've given me in the past to our clients as well. Before we start, I just want to introduce Dr. Khoza. Dr. Khoza is a dermatologist at the eThekwini Hospital. She also works out of Hillcrest part-time. Hey, you do sessional work there, huh?
Yeah. No,
she has, during the COVID crisis, she is still consulting online, but she has a passion for all sorts of dermatology, and it's amazing just listening to her talk about her work, and that's exactly why we've connected so well. It's just that her passion for all ailments, and not just aesthetics, but also for the really, really sick people. So, Dr. Khoza, thanks so much for joining us. I don't want to take too much of your time. So, the reason why I got you on today was really just to discuss something that a lot of our clients come in with, especially our larger breasted ladies. And it's something that I realized is quite a big problem on, I went to the breast reduction support group, which is huge, by the way. And they did a questionnaire, and on the questionnaire, they actually asked what their biggest problems were. And something that ranked quite highly with back and neck ache was this rash that they get under their breasts. Can you give us a little more insight in that, into that?
Yes. There's actually a lot of reasons why people get rashes under their and obviously we see patients come in with many conditions. Can you hear me?
Yes, I can. It does break every now and again, but it's good. Yeah, it's good.
Okay, all right. And so I think when we're looking at rashes in the breast, we have to kind of put them in categories, and also just understand that the breast is one of those areas we call intertriginous area. So intertriginous areas are any areas in the skin where there's a fold, so there's skin to skin contact. So intertriginous areas will be underneath the breast, in your armpit, in your axilla, between your inner thighs and in the groin. So the commonest condition that affects or that causes rashes underneath the breast is something that we call intertrigo. Now, intertrigo will be worsened by the fact that there's a lot of sweating there. So usually the problem comes with sweating and with moist and poor air circulation. And so that environment cultivates or puts you at risk of anything like candidal infection or yeast infections, bacterial infection, or any infection. You know what I mean. So you can get a lot of core infections underneath the breast. And so we call that submammary intertrigo. So that's the main problem. And the important thing to take home is that yes, we see this in women with bigger breasts, but sometimes it's not the size of the breast. Sometimes it's the shape of the breast, because women with thin or small breasts still get rashes underneath their breast. Rashes underneath their breast. And that's because obviously the breasts, they fall as we age, as we have children and stuff. So it's not exclusive for women with bigger breasts. yes, we see it more common in those areas, but anybody can get rashes underneath their breast. I mean, my breasts are small. I feel like I'm holding my boobs a lot. My breasts are small, but I still, but I still get rashes. I'm so glad nobody can see
I
me,
think,
but but I
no,
feel like I'm
no,
playing with it.
it can see your, no,
But yeah,
I think one of the biggest
but
take homes there, well, yeah, I think
yeah,
is that it's quite normal then, that it's not
it,
just
it
confined to your bigger breasted ladies.
no, definitely not. And although, you know, I mean, I've mentioned something called figo, but also we need to remember when you get rashes under your breast that there's a whole lot of other conditions. There's skin conditions. There's a condition called inverse psoriasis, which will look like intertrial. You can get eczema underneath there. So it's common around your nipple, but you can also get it in the area. You can also get, which probably is important for you. You get what you can also get what we call contact dermatitis. Now, contact dermatitis, you can get irritant contact dermatitis. You can also get what we call allergic contact dermatitis. So that's when the bra or the bra fabric, as well as other things, start coming into play, because you can get friction dermatitis, which is, you know, a form of irritant contact dermatitis. And you will see that in women who are, you know, wearing bras that are not the right size or the right fit for them. You also see that in women who, because some women have asymmetric breasts. So someone will have a smaller breast and the other one will be bigger. And so if the bra doesn't speak to that, you'll find that the smaller breast actually suffers more and you get more rashes from that because it keeps on, you know what I mean? It's like dangling in the bra. So you get bruises, you know, in those areas. And then you get women, obviously, when they're exercising, a lot of friction because, you know, your breasts are just bouncing in and out of your bra. Um, and the contributing factors to that are fine, the bra fit, as well as the fabric itself. Sometimes also the bra clip. And then people always say, okay, am I reacting to the fabric, or am I reacting, you know, that those kind of questions. So the most important thing about contact or allergic contact dermatitis is that when you look at it in isolation, the condition is usually, you know, when you react to your clothes, the condition is called textile. It's called textile contact dermatitis. And the most important thing there is that sometimes it's not the fabric itself, but the preservatives or the things that they add onto fabrics to, let's say, to keep the fabrics not ripping, or and also the dyes that they add onto the fabric. So those are, you get more reactions to that than the actual fabric itself. But yes, we can isolate that because we can do something called patch testing, where we kind of expose you to each of those ingredients to figure out, is it the dye, is it the preservatives in the clothes, or is it the actual fabric? And
What about the
both
detergents
ways.
though? Do you
Pardon?
not do you not find that detergents could also be a contributing factor to what they wash their bras in?
So exactly. So that's very important because that is true. Because before you get to actually, you know, saying this is directly related to the item that you're wearing, you have to isolate other things like your soaps, the detergents, cosmetics. We apply a lot of cosmetics to our boobs. All of those can contribute. And I don't know if women actually do this, but sometimes we say when you buy an item of clothing, especially for people who have a lot of sensitive skin, a lot of reactions, and that may be an item of the brow. And if you're thinking along those lines, you're actually supposed to wash it first before you wear it. So I'm not sure if people actually do that. So you might, whenever you buy something new, whether it's bra or it's an item of clothing, and you are the person that tends to react, try and wash it, and obviously wash it with hot water and warm water, and make sure that you know you've washed and before wearing it.
I think a lot of our clients land up getting so excited about finding a bra that
I
works for
know.
them, just take it home with them. They don't
Uh,
even, they ask you to take the label off in the studio and then they just leave with it. So that's
yeah,
very relevant. You should actually, you should wash your any item, especially now. I think more than
yeah.
anything, we should be looking at washing our items before we wear them. Another thing that a lot of ladies, and I've just been reading the questions as they come about here, one of them was, I'll give you all of them. One of them was, do you exfoliate? Should you exfoliate under? I'm just looking at that, thinking that must be the most uncomfortable thing to do, especially when you've got this irritated rash. And the other thing was deodorants and roll-ons and powder. This is, it's a common, it's a common sort of practice amongst women who try and eradicate this. Also because there's a certain amount of shame that comes with it as well. People think that they're isolated and that they're the only person with this unsightly rash. So I want to also make sure that people realize this is really normal. We see a lot of it. It's not, we're not the only one. But that how do you counsel against or for the home remedies like deodorant, talcum powder, exfoliation?
Well, you know, I used to be very strict about it in the beginning, but it's very uncomfortable. It's like, you know, rashes under the boobs are very uncomfortable and women can't cope. So the idea is that you keep the area of the skin dry.
Mm-hmm. So that would be lifting the bust up, getting a good bra. Okay.
Yeah, so a lifting bra actually does, you know, a great job. And obviously the other things that you can try is, you know, after you've washed, we always say pat dry. Make sure that it's really, really dry. You can even use a hair dryer there, but make sure that it's not a heat. You know, don't want people burning themselves. But you can use a hair dryer because, I mean...
Can you imagine shame?
No, but I mean, you know, you have to lift the breast because it's sometimes it's big. And so you can use a hair dryer, just put it on a cool air setting to dry the area. I've recommended using dry gauze to some women. So you get gauze from the chemist and you can use that. I've actually used it. I've also recommended for women who sweat a lot, I've recommended using panty liners. Don't repeat me, but yes, I've recommended panty liners.
That's actually a really good idea though, because they've got that absorption.
Yeah. And just make sure unscented ones, you know, with no fragrance, especially when you have sensitive skin. You can use antiperspirants underneath your bra because it does help. Because remember, the problem is sweating. And so if you want to control the sweating, you can use antiperspirants. Obviously, you choose them well. Okay, choose, you know, ones that are not irritating, and choose, you know, ones for sensitive skin. I mean, there's an antiperspirant spray that I recommend so much by Dove because it is very it's for sensitive skin and it does work. But I will not use antiperspirants on skin that is eroded or open. So if it's raw and it's, you know, I wouldn't really use them. I would use them for someone who's trying to control the sweating, but the barrier hasn't been breached yet. And yes, you can use powders too, you know, because it does help. Because, you know, we have to give people solutions. So we can't say no, this, no, that. So you can use a little bit of that. I just don't like people layering layers and layers of powder because it ends up being a plug, and sometimes you don't know whether the plug is safe or not. And I always say make sure that you washed your breast and clearly before you come to the practice so that I see traces of powder on your skin. But those things do work. Powders can work. Antiperspirant, just choose a sensitive one. Make sure your skin is not breached. There's no rash. There's nothing. So it's fine. Can help you sit. Dry dressings help. Panty liners help. All of those things. You try as much as you can. I would not exfoliate underneath the breast because then now we're going to start thinking about what exfoliating products you're going to use. We don't know how irritating. It's just too much. I wouldn't do that. In fact, sometimes I even say no soap. I just say just warm water and just sometimes, I mean, because we can get really, really hectic rashes there. And sometimes we need antiseptic washes, even those. I mean, I dilute them so that they're not irritating the area. Because, I mean, it's a moist area. It's very sensitive. So you have to choose your products carefully. Because sometimes you start choosing the wrong products and then you worsen it. Now you don't know what started. Was it this, or you now have irritant conjunctivitis and it's a mess. And of course, you have to get the breast off the skin. So you need that lift from your bra.
And tell me, at what stage should a patient come and see you? So they've tried all these things, and they're still very uncomfortable. When do you think that point is that they should seek help from a specialist like yourself?
So I think, you know, it makes sense that you can try a lot of things. Sometimes we also recommend using over-the-counter mild topical steroids, like something like, so you can get preparations over the counter and they will have a mild corticosteroid. They may also have a mild antifungal in them. So you try those things first. But I mean, when you've tried everything that we've spoken about, remember I said there is a whole long list of conditions that will affect the breast. Because when you're talking about psoriasis, eczemas, intertrigo can be really bad and you may need oral medication. So you may need medication to be taken by mouth. And also because you're dealing with a dicey area, everything will look red and everything may repeat. Sometimes everything's going to cause you pain. So if it's really, really, you know, you've tried everything, and I would say women must wait months because that's when we see them. Because you did mention that they get embarrassed, so they sit at home. So before trying a lot, if the rash is not settling in a week or 2 weeks, I do think you should, you know, see your dermatologist, and then because what you want is a diagnosis: is this, or is this that, or is it more?
I think a lot of, you know, as women, we tend to prioritize everything else in our life, and we just, that kind of goes away until we have to deal with it when we put a bra on or have a shower, whatever the case. And it's like, oh, we need to make an appointment. We need to make an appointment. But then another day, another week, you know how it goes.
Rolls on
And
to
before you know it,
yeah.
especially now, I'm sure. The other thing that people have asked about is the darkening of their skin and the shoulder areas, and even around where your bra strap or your bra band can sit. What causes that darkening, and can it be avoided? And what would you recommend people do to try and, once it's gone or once they get rid of it, to stop it from coming back?
So that's very common. I mean that's that's a tight bra.
Yeah.
And I mean it doesn't always happen on your shoulders. You'll see it on the side, and sometimes at the back, and then sometimes your cleavage. And that's so. So I mean, it's quite self-explanatory because that is just trauma from friction of a tight. Like when you put a tight belt on, eventually you get bruising, and you get that bruising, and then obviously it will start off as being red. It will be painful. Eventually, it will turn into a dark mark, which is part of the scar. But I find that it's actually quite easy to sort out because it's actually a superficial kind of bruise, or like a, you know, it's like a chin burn. So usually when we've, you know, eliminate the tight bra, get a proper fitting bra. That's one. And then two, I usually recommend very mild exfoliation, and they work wonderfully. So I usually use you know, because you want something that's hydrating, but it's also going to exfoliate the skin gently. So I normally use something called A-carotene, very mild. It has like salicylic acid in it and lactic acid, and it gently exfoliates the skin. And you find that in the pharmacy at discount called A-carotene. It's by Hygiene. And that works a lot. In stubborn areas, you may go up to a strength of A-carat 30. And then after that, you want to moisturize as well. And that's also another place where you can use a mild over-the-counter you know, steroid. And those do really, really well. Now, there are sometimes I've used sort of higher strength salicylic acid in my practice just to peel, because, you know, these young ones who, you know, have to wear their bikinis and stuff.
Yeah.
I told you I'm
These
taking my
young ones.
No, I'm not saying, but you know, because I mean it's important to show your back for some people. So so I may do like a mild salicylic peel, which is very gently on the skin to help with the pigment. Now and again, I may add a lightening agent, especially if it's an exposed area. But I think the crux of it is to don't get it, so prevent it by just finding the proper bra, because those are directly related to bras most of the time. Now, when people speak about dark marks on their breast, right? I always have to ask them. Can you hear me?
Yes, no, we can perfectly.
Okay.
Sorry, I know I've got this frown line. I need to come for some
Yeah.
Botox because I think
I
I can't hear you. In the meantime, this
keep
is just normal. Sorry, I'm like, she's gonna say I need Botox.
sorry. I'm
No,
sorry.
I'm
That
looking
frown
at it
is
thinking,
strong.
I'm looking at it thinking I need Botox. Okay.
You look beautiful. You look
Oh,
beautiful.
thanks.
So, but that frown is strong, but you look beautiful. I'm joking. I'm joking.
No, it's
Um,
okay.
uh, so, um, but the most important thing though, because we've done the bra burns, which are those marks that you're talking about, and yes, there are ways to get rid of them. So number one is choosing the right bra, and then the other things that I've spoken about. Now, whenever I hear women saying that they have dark or pigment in their bras, I mean in their breast. Number one, I mean we've spoken about all those conditions, the psoriasis, eczema, that I was telling you about that can affect the breast area. And so you can get scarring from that, which is hyperpigmentation, especially in dark-skinned people. So you can get post-inflammatory hyperpigmentation. But the friction as well can give you other growths in the area. So in the dark population, we get what we call dermatosis papulosa nigra, or we call them DPNs. It's those black, brown, almost like warty things. Sometimes we get them on our neck, and sometimes we get them on our faces. And then you start seeing them in between your cleavage and underneath the breast. And so someone will say, I'm getting pigment spots on my bra area. So that's another condition, which is so easy for us to treat. We just burn them and they fall off. In my light-skinned patients, you get a similar kind of thing, but theirs tend to be more browny and more flat. You know, you'll see it exactly underneath the bra, especially where the bra sits. And they also look warty, but they're just these low growths. And when they sort of meet together, they give you that dark pigment. So those are growths and things that happen in the breast area because of friction and also age and stuff that sometimes give you the illusion of pigment, and they're not at the level of the skin. So be mindful of that as well, because you can see them between your cleavage and underneath, so we can also, get rid of those. I wanted to tell you about one condition because I know a lot of people sort of suffer from it, especially women who are big-breasted. And so you would expect that they're slightly not obese, but they're slightly overweight, and they may have other medical conditions that are brewing or already there. So women who have diabetes or who have insulin resistance, women who have PCOS, they may get darkening of the skin in between their breast and underneath the breast, and they may be concerned about this. So the most important question is, where else is the pigment? Do you have a similar pigment in your armpits? Do you have a similar pigment in your neck? Do you have a similar pigment in between the thighs? Because that's a condition that we call acanthosis nigricans. And whenever I see that, it tells me that there might be a metabolic problem going on in this patient. We have to look for whether there's diabetes or there's pre-diabetes. And so weight loss becomes an important treatment tool for there. And also, consultation with a dietitian and just looking deeper in terms of the metabolic and hormonal kind of affectation in most of these. So it's very important to try and characterize pigment into, is it directly related to the friction of the bra, or maybe are there other conditions that are now creeping in, or is the skin telling me more and I should have those things looked at?
Just hang on before you, sorry, there are lots of questions here. I just want to, what we're going to do afterwards is because Dr. Khoza's time is very, very precious, and also I'm stealing a little bit of her time here. So all the questions, I've got them. What I'll do is I will do a post after this with all the details. I'll also give you the details on how to contact Dr. Khoza to make a consultation, because she's consulting online. But what I think the biggest take home from what you just said now is that, yes, there is a lot of things that you can do before seeking professional help or contacting someone like yourself, but that you shouldn't let it go for too long, because there could be underlying factors that could actually be potentially life-threatening, especially when you consider something like diabetes,
Yes.
or maybe even thyroid, or any of those metabolic conditions. So I think that is definitely important. So yes, it's all fair and well trying all these over-the-counter remedies, but I think as women we need to be honest with ourselves and looking at the situation and saying, right, this has been going on for long enough. I need to prioritize myself, and I need
Yeah.
to make sure that I look after myself so that I can carry on doing the 5 million things that you do on a daily basis.
Yeah.
So I didn't realize that. That's quite interesting. It's also really important for our fitters to know that, because
Yeah.
obviously we get up close and personal with
Yeah.
our clients. So making that observation is another added or added value to our client, because I think, yeah, I mean, it takes a long time for a client to come and see us because
Yeah.
they have
Yeah.
so many things on their plate
Yeah.
that having all this kind of information definitely adds value. So thank you so much for that.
Okay.
Is there anything, Hazard Lee, thanks so much for the shout out there. Is there anything that you would like to add before we close off? Just from your day-to-day point of view. Before, I know that there are lots of questions. Please, we are going to put this in a post.
Well,
So
sure.
give us about 20 minutes just to summarize what was discussed here, and then we'll put it in the post, and it'll be on my feed, and I'll put it in the stories as well.